All right, guys, let's start comparing some of our mood disorders here in our graph. And remember, in this graph, time is going to be on the x-axis. Here, we're talking about months. And on the y-axis, we're going to have high energy, high moods here, and then low energy, low moods here. Now, we'll start off by talking about schizophrenia, and this is going to be our orange line. So if we trace our orange line all the way out, you'll see that it passes this important 6-month mark. That is super, super important. You cannot get a diagnosis of schizophrenia without having symptoms for 6 months. Now, let's compare this to our schizophreniform disorder. This is going to be our magenta line. And this line tracks all the way up until just before 6 months. And that is a key point. You cannot give someone a diagnosis of schizophrenia until they reach 6 months. That's why we reserve schizophreniform as a diagnosis for these patients. Now, in terms of schizophreniform and schizophrenia, these patients can move up and down out of the normal range of what we would consider normal mood. So the green line that I have is what we consider normal mood, and you'll see that the schizophrenia and the schizophreniform patients can kind of jump out above and below normal mood. However, it's not necessarily a requirement. And we'll see that schizoaffective disorder is simply diagnosed by greater than or equal to 2 weeks, so about half a month of psychotic symptoms. Whereas delusional disorder is just going to be delusions. That's the only psychotic symptoms they're going to have. And so they're going to live here within like this 2-month mark of having delusions. And that's a really great way for you guys to compare and contrast these different mood disorders. All right, for our next set of mood comparisons, we're going to be comparing bipolar 1, bipolar 2, and cyclothymia. Now, it's important to note that here we're going to be talking about order of days, not months here. So when it comes to bipolar 1, remember that we are going to have symptoms for at least 7 days. So if this is about day 1 and this is about day 7, you'll notice that we have an extremely elevated mood characterized by true mania here, as opposed to our bipolar 2, where we're going to have hypomania, so an elevated mood, but not severely elevated. And this is going to be on the order of maybe like 4 to 5 days. Now we're going to compare this with cyclothymia, and you'll notice here that this is going to happen for 2 years. So I made a little label here on this screen that this occurs for over 2 years, and they're just going to kind of drift up and down, up and down, up and down, just outside the range of normal mood, but still like slight elevations and slight depressions in our mood. And that's how we're going to differentiate these 3 disorders of mood. All right, for our final set of mood disturbances, we're going to talk about psychotic and depressive symptoms and their mixture and the corresponding conditions. So starting with MDD, we're going to see this dark purple line here. And MDD is going to be characterized by greater than 2 weeks of 5 or more Siggy CAP symptoms. And that's what I'm showing by this big decrease in mood in dark purple here. You'll notice this is not accompanied by any psychotic symptoms. However, if we're talking about our pink line, which is MDD plus psychosis, I'm going to highlight a little bit of psychosis down here in yellow at the very deepest part of our depression. That is characteristically when you're going to see the psychosis in MDD plus psychosis. Now, for our next disorder, we're going to talk about brief psychotic disorder. And you'll see that I have it listed here as a mood elevation, but it could have also been a mood decrease. It doesn't really matter. All that matters here is that we have psychotic symptoms somewhere between 1 day and 30 days. So just longer than 1 day, but not quite more than a month. And it's important to note that these psychotic symptoms are due to stress, and stressors usually cause an increase in energy or a decrease in energy, just depending on the stressor in someone's life. So it's important to note that these psychotic symptoms are due to a stressor and are going to last less than 1 month in duration. Finally, we're talking about dysthymia, which we have here in blue, and this is going to be a chronic depression. You're going to see here that it's mild, so it doesn't get quite as low as MDD did. However, it lasts a long time, so it needs to be a mild depression for longer than 2 years. And that's how you're going to keep these depressive and psychotic symptoms and their associated conditions straight on test day.